السلام عليكم جماعة. أبرك بابتي ما السر هندك بيزانينا السر خوينية. Introduction to Blood. طبعا نهركز كش ما هلا يعني خو أبد خلقت عام ما بين اختصاص في أمي زانا خوين چيا هم يا ما هم يا خوين ديتا تقريبا زانا شو اللي بيجي چيا بچه که من باگراوندا سر خوینی ورگرن چکو کورس دوی سمستر دوی شولی ما همی سر خوینیه او فحصت ام دبکار اینن وکو کریاتینین یوریا جي او تي جي بي تي بلاد جلوكوز فحصت هنا جالك بربلا من المختبرة تقريبا حفتها تصدش فحص مختبرة أفنا وأفن أف دو فان تيستا بكي تو محتاج خوينية في جواب بيتفي أما عندك بيزانينة ورد السر خويني حبتن. Blood, definition of blood is a tissue circulate in a closed system of blood capillaries or a fluid rotate inside the body and pumps from the heart to the other tissues, and it's formed from plasma and blood cells. خوي اوجك شوناك السيستما كي داي خستي دا الشريان وريد وكابيلاري بتوت اينتن ودل خوينه بامبت كتبو همي جها وديف دهر او خوينه زفرة تبع و blood consists of cells and plasma. The cells like red blood cells, white blood cells, and platelets. These three components are cells. The blood represent, and these cells represent about 45% from the total blood volume, while the rest is plasma. The volume of blood in normal cases approximate from 5 to 6 liters for male and 4 to 5 liters for female. So you see in male the volume is larger due to the size of men is larger in most cases. This is 45% cells, 55% plasma. The cells, red blood cell, this is the structure, this is the shape of red blood cells, this is the shape of the platelet and white blood cells, which we have many kinds. Blood in the arteries الشريانة brighter red يعني صورة كذا كريهة إجبال تركيز أكسجين الويري قال لك find that also it has a pH of 7.35 to 7.45 making it slightly basic يعني مش حفتي بتر منزون هكا حفتي بتر بدي بشكل basic. Surely, what's the functions of blood? Obviously, a countless number of functions for blood. It carries out transport function, transport of like hemoglobin, hormones, vitamins, etc. It has a protection function because it contains antibodies, white blood cells, and it also regulates many systems like regulation of pH, regulating of temperature, etc. Blood transport the following substances, gases, namely oxygen, carbon dioxide, and nutrients, vitamins, minerals, etc. Waste product, urea, creatinine, they transported it to the kidney to get excreted. Transports hormones, heat to the skin as to it also transport the heat to regulate temperature. Protection, blood has several laws in inflammation, leukocyte or white blood cells destroy invading microorganisms and cancer cells. Antibodies and other proteins destroy pathogenic substances. Platelet factors initiate blood clotting and help minimize blood loss. Regulation. The third main function of blood is regulation. It helps regulate pH and water. It regulates pH by interacting with acid and bases, and it regulates water balance by transferring water to and from tissues. Component of blood component: liquid phase, plasma. This plasma, which is the color is yellow or close to yellow, it contains, this plasma contains mainly water, contains electrolytes, protein, sugar, vitamins, lipid, and hormone. The solid phase, which are the cells, erythrocyte, leukocyte, blood, platelet. Red blood cell. Red blood cell, or another common name is erythrocyte, is a disc shape, discia grovera, with a thick rim and thin sunken center shape above. We have seen the shape. The cytoplasm of red blood consists mainly 33% of hemoglobin. So obviously, this is the function of red blood cell, to transport hemoglobin. So obviously, we can expect the cytoplasm to contain large amount of hemoglobin, which gives a red blood cell the red color. What makes red blood cell and what makes blood red is hemoglobin. Hemoglobin carries most of the oxygen and some of the carbon dioxide transported by the blood. Red blood cell produced by liver, which is the essential organ for red blood cell production in fetuses, mammalian animals, while the spleen and lymphocyte nodes come after the liver in important. After birth, the bone marrow become the main source of red blood cell production. Red blood cell it differentiated, or it come from the stem cell, which is inside the bone marrow. Circulating erythrocyte leaf age is about 3 to 5 months. White blood cells, they are colorless, doesn't contain hemoglobin greater than red blood cells. So here we have important differences that you can pick up, and their number less than red blood cell. White blood cell can be classified into two kinds: granulocyte, agranulocyte. Granulocyte like eosinophile, basophile, neutrophile. agranulocyte غير حبيبي، يعني تشن نقطة كتيدانينا سكتو ساكن ايزنوفايل، كان ايزنوفايل أبعاد سكن نقطة حبيبية. بازوفايل حبيبية. نيوتروفايل حبيبية. ليمفوسايت سكت شي حبيبات أو تيدانينا هكا بجي على كيما. Platelet, responsible for clotting of the blood, also made in bone marrow, short life, 7 days. So this platelet, it has an important role, major role in coagulation, blood coagulation. What's blood coagulation? The process of coagulation starts by formation of active thromboplastin, which formed from the breakdown of blood platelet, where the thromboplastin act to convert from the prothrombin, which found in blood, to thrombin, and the calcium is essential for its conversion. Thrombin convert the fibrinogen to fibrin. Fibrin is solute as a clot, shown below. طبعا عرفت ميكانيزمات قالك بشوكي قال بسيطة بوجودي أنا أو بلاد كواجيليشن بروسيس كي قال معقدة قالك أو هكا أم دوبش بكن دوبش كلام بو primary hemostasis and secondary hemostasis. Primary hemostasis الويري وقت الدسبيكا coagulation platelet activation بويتشل بت ودي the aggregation بويتشل بتكومل بتقلق aggregation بويتشل بت pack of platelets. بس الفيري اف platelet هنا نقلك بهيزة كوبشيت خوينة بسكنين نزيفة بسكنين الفيري ما secondary homeostasis الفيد عن secondary mechanism مدفيتن دا اف aggregation ها بهيسكت وكاتشاو بونمونا بلوكا تدين سريك او بلوكا هيك بتشيكي ديت تحفك اللي ديت همي حرف بس هكا او بلوكا سريك بن وجبل نيفي دابت جبلك وبتشمانتوه زحمته حرفان دنا فيديوري مانا بالفيري او بلوكا بليتلت او جبلانا وشمانتوه فايبرينا اوكي اف فايبرينا بشواكي معقد درست بتن فاكتور ايك دو سي چهار پنج شش هفت هشت تدخل هشتاج جدد بروثرومبين ماهي كي ثرومبين بتا ثرومبين هاري كاريا كالسيوم اگر كالسيوم نبت معناه ثرومبين چه نابت اما فايبرين چه نبي اما ده نزيف چه بت فيتامين كي اگر نبت اما فايبرين نابت پولیمر اما هر دوباره نزيف چه بي جا كالسيوم هاري كارا بو بروثرومبين بتا ثرومبين فابرينوجين بتا فايبرين فايبرين اف فايبرين كلود بوليمر شبكة كيتشت كت بو بليتلتي ونهلت نزيف چه بتن بالمقابل ما هندك ريك هنا كو خوين نميت ونمونا هيباريني inhibit the formation of thrombin from prothrombin نهلت ابد شبت جبه في blocked كت هيبارين okay it's usually available as the sodium, potassium, ammonium and lithium salts. ADTA, it inhibits coagulation by chelation calcium. Calcium يثبت اگر calcium نمو فنزيف coagulation چه نبي مانا oxalate and citrate also acts by precipitating the calcium. أبجي هر calcium يثبتن وهر دي صنع coagulation شيء بتن. Sodium fluoride it is also considered as an anticoagulant, but since large amounts are needed, it's rather used as a preservative for glucose deamination by integrated loss, serum glycolysis and bacterial action. What are the difference between serum and plasma? I have a plasma and have a serum. Okay. Answer: plasma obtained by adding anticoagulant to whole blood. يعني اگر تو خوينه بينه بكي جيلاتيوبي دا او جيلاتيوبي زا چه انتيكوغلانت دانينا و تو بچه فصل بكي تو دي سيرامي بدا سخواه ايني اوكي و اگر تو ايدي تي اي تيوب كاربينه او ان انتيكوغلانت دابت و تو خوينه بكي تيدا و تو بچه فصل بكي او سري دي بتا بلازما اوكي plasma obtained by adding anticoagulant. Plasma differ from serum in that it contains fibrin. Plasma fibrin تداهية and other soluble clotting elements, and serum is the clear yellowish fluid obtained from separating whole blood into solid and liquid component after it has been allowed to clot, also called ava serum liquid minus clotting factor fibrinogen verity danina clotting minus blood cells okay plasma clotting element تداهية ava تدانينا. Blood collection. Blood is usually drawn from patient by a syringe and then transferred immediately to a clean tube. After removal of the needle to prevent breakdown of red blood cell, the tube is then centrifuged after clot formation, which takes about 10 to 15 minutes, or immediately for plasma. I hope you have it.